Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Clinical features of unilateral injuries. If there are unilateral ureteral injuries, only unilateral, okay, unilateral ureteral injuries. Now, in unilateral ureteral injuries, the patient can have no symptoms. If there is no symptoms, that means, for example, just make an important thing here. This is a kidney and this is the ureter. For example, this ureter has been injured or it has been ligated, and if the patient has no symptoms, that means we don't know that we have accidentally ligated the ureter. So slowly, without unknowingly, the whole kidney might get atrophied. Why? Because of pressure atrophy. See, this area of the ureter has been ligated unknowingly, so there is accumulation of fluid is seen in the ureter, followed by the in the kidney also, and as a result, this will result in silent atrophy of the kidney can occur together. So this is one thing. Second, the patient can present with loin pain and fever. Remember, in ureteral injuries, fever is not common. Pain definitely it can occur, but fever is not common. But if there is loin pain and fever, always think nephrosis. Pyo is infection, that is, there is some obstruction or there is extravasation of urine. Thus, because of that, infection has occurred through the obstructed system, resulting in pyonephrosis. Okay, if there is pyonephrosis, then what do you do? If there is pyonephrosis, you should do a urography. If urography shows no function, if urography shows no function, then you should insert the percutaneous nephrostomy. If urography shows no function, then insert the percutaneous nephrostomy. So already there is hydronephrosis. Now if you insert a percutaneous nephrostomy through the skin into the renal pelvis, so all the fluid will get drained through the nephrostomy to outside, so this pressure will be relieved, and thus at least the remaining pressure atrophy of the kidney can be saved. So this insertion of percutaneous nephrostomy is done to mainly relieve the obstruction. Then this is the second thing. One, there can be no symptoms. Second, loin pain can be there. Then third category is there has been a ureteric injury and over time there is fistula development. That means this is the ureter and there has been injury here. So there is extravasation of urine, all this is happening, and slowly there is fistula development. Okay, if there is fistula development now this fistula will develop through the abdominal or vaginal wound. Like this fistula can connect into the uterus or vagina, resulting in ureterovaginal fistula, uterine fistula, or it can be through the abdominal wound. But whatever type of fistula it is, first you should insert a nephrostomy should be done. One, and then you should postpone the repair until the edema and inflammation have subsided. Once the edema and inflammation have subsided, then we can do the repair of the ureteral injuries. So these are the three types where the ureteral injuries can be present.
thank you and thank you for watching.